Welcome back, future nurses. My name is Dr. Kathleen Jude Estime, and we will be talking to Professor Katrina Leandre, who's got one of the world's best NCLEX reviews. If you go to her review, you're almost sure to pass the NCLEX. Today we're going to discuss renal scenarios and what to do. Question 1, Professor Leandre, we're talking about critical thinking and safety. So here's the scenario. There's a client with acute kidney injury and reports decreased urine output and swelling in their legs. What's the nurse's very first priority action?
Pause and think. Should we assess vital signs, notify the provider, or check the patient's lab results? Always remember, patient safety is priority 1. Decreased urinary output can indicate serious complication, so timely assessment is crucial.
Professor Leandre, therapeutic communication is really difficult for our students. They think that they should answer based on how they would answer in real life. We all know that NCLEX is the perfect world. In therapeutic communication, if a client says, "I'm scared about my dialysis treatment," which response is the most therapeutic?
Hint: avoid dismissing their fears or changing the subject. Instead, we validate their feelings and encourage them to share more. Therapeutic communication is key in nursing, especially in chronic conditions like renal failure. That's why in my coloring books and worksheets, I provide examples you can practice.
Question 3 is about medication. Your client with chronic kidney disease is prescribed atenolol. What lab values and side effects should the nurse monitor closely?
Think renal function, potassium levels, and potential side effects like bradycardia or hypotension. Medications related to renal health show up frequently on NCLEX. My digital products break these down into easy tables, ensuring you remember critical information.
Question 4, what about delegation scope? When caring for a client undergoing dialysis, which task can the RN safely delegate to an LPN or CNA?
RN handles assessment, teaching, complex patient care. LPNs can monitor vital signs during dialysis, while CNAs can assist with basic hygiene needs. Delegation is a vital skill in nursing. In my tutoring session, I emphasize scenarios like this to reinforce your understanding of scope of practice.
Question 5, complications. A client developing post-operative complications after kidney surgery exhibits signs of infections such as fever, redness at the incision site. What's the best first action for the nurse?
Assess the incision site, check vital signs, and notify the healthcare provider. Always prioritize assessment in serious situations before implementing any intervention.
Hey, if you found these questions helpful, don't stop here. You can grab our NCLEX renal coloring books and download digital study guides or sign up for tutoring. And remember, our NCLEX review program includes weekly TikTok lives and Sunday Zooms. Stay with us until you pass. Visit our link tree in the bio to get started. See you in the next episode, and remember, you've got this.